Hello everyone! Welcome back sa YouTube channel ko. Again, it's me, Alona. So, today, may iba na naman tayong topic na pag-uusapan. Okay? It's about babies. At saka pregnancy. Because when you're pregnant, you need to plan kung anong gagawin mo paglabas ng baby mo. So, I'm going to talk about the so-called nipple confusion. Tatanong ko, marami nagtatanong sa akin when I do prenatal teaching, is the baby really confused? Confused ba talaga ang baby pag nagagamit ka ng bote or nipple? I bet many of you are also asking this question or believing na confused. There's so-called nipple confusion sa baby when you introduce bottle and while you're breastfeeding. So let me explain to you, okay? Nung sinauna, nung wala pang nagawa ng mga research about nipple confusion, using bottle feeding, that it can affect the baby's latch, yes, I'm gonna say yes to it affects the baby's latch. But I will say no to nipple confusion because pag ang baby only newborn, there is no such, based on research, wala pang ability yung baby o capability yung baby na mag-develop ng confusion because of nipple. Okay? But the term that's used now ngayon, based on research, is nipple preference. Preference. Meaning kung anong type ng baby, kung anong gusto ng baby. But it's not confusion. Okay? That's based on research. Pero marami pa rin mag-disagree, mga other healthcare providers who still believe na kung ano yung sinaunang mababasa mo sa mga books, that bottle feeding can make the baby confused for a very early age, 1 month, 2 months, 3 months. There's no such thing in research that it shows na nako-confuse ang baby. But baby develop preference. That's the so-called nipple preference. Now, I'm gonna start. When you're breastfeeding, okay, and baby baby is used to the nipple, okay, your own nipple, then you introduce the bottle dahil you decided, okay, i-mix feeding ko na si baby dahil I'm going back to work, or i-mix feeding ko na si baby dahil hindi ko na talaga kaya ang pagod na mag-breastfeed all the time. Breastfeed ko si baby dahil hindi ko na kayang mag-produce ng maraming milk. No matter what I do, wala talagang nangyayari. So, I'm there with you, okay? I understand kung bakit kailangan mong magamit ng bote. But remember, there are many ways on how you can feed the baby, okay? Cup feeding is one of the best ways na maiiwasan ang bottle feeding kung komportable kang magamit nito. The only problem with cup feeding, okay, even though mas maganda siya kasi hindi na kakaveran yung pananatiling nipple breastfeeding mo as compared to using the real plastic nipple or silicone nipple. Now, the only problem with this, pag pinapakain mo si baby with the cup feeding, mas marami pa yung, based on research mas marami pa yung natatapon sa damit ng baby kaysa nainom ni baby. So, if you have limited milk, kung kulang ka sa milk, and then you use cup feeding, nasasayang lang yung iba mong gatas because normally ang baby pag pinifeed mo while they're licking, may sasayang pa rin. It's wasted doon sa spilling. Now, if you're gonna use I'm just gonna get my syringe para lang talaga maiwasan mo si bottle, you can do the same thing too. So, ang syringe, what you can do, lagyan mo ng milk ito. You can buy a 50 ml syringe, yung malaki nito. Just buy a little feeding tube. Or kaya, just remove it. You can use just the syringe, okay? So, if you don't have a cup, kung wala kang cup, use a syringe. And then, put the baby in upright position like this. Then, pwede mong mag-syringe feeding ka, okay? Now, take note. Pag nag-syringe feeding ka, make sure let the baby lap yung sisip. Huwag kang spray ng spray, okay? Do not spray it, okay? Because mag-choke si baby or aspiration is wrist for aspiration. So you can use that. Or kung gusto mo rin, more if baby is mga preterm, itong gagawin mo, lagyan mo ng maliit na feeding tube. Then you can put the tube in your finger. Kung gusto mo, you can put the tube in your finger and let the baby suck your finger. Well, ito, depress mo ito. You depress it slowly. So those are the ways on how you can prevent nipple preference. Now, if there is no way that you have the access to syringe, tube, or cup feeding, do the bottle. But remember, the bottle feeding technique that I taught you, go back and watch it again. Again, it's not bottle confusion or nipple confusion now. It's nipple preference that the baby will develop. Dahil nga, mas masasanay si baby nito if you use more on this as compared to latching. Now, some moms, they have trouble switching na kahit anong gawin nila, it doesn't work for the bottle. Kahit they're going back to work and they're gonna try the use of bottle feeding. My advice to you, if the baby still refuses to use the bottle, do it slowly. Okay, if you're going to work mga 2-3 weeks from now, start training the baby. Okay, start training the baby. If I were you, kung matrain mo talaga, during feeding time, go away. Maybe punta ka sa kusina, huwag kang pakita sa baby mo during feeding time. Let your husband or nanay mo sa bahay ang mag-feed ni baby para hindi ka makita ni baby if you really want to train the baby na mag-bottle feed dahil babalik ka na sa trabaho or you just need a break. You have the choice, mommy. I know you care for your baby, but if there's any way na mas may time kang makapag-break and at the same time your baby is not starving, I'm okay with you if you're gonna use the bottle. But if you have time talaga na mag-breastfeed, that's the most effective way to feed your baby. Now, train your baby how to suck. Ito ang gagawin ko, okay? How to suck from the bottle. What you can do is wash your hands. If you want to wear gloves, do ahead, but make sure just wash your hands. Before you latch the baby, kung si baby ay may problema mag-latch o may problema sa bottle na to, put your finger in the baby's mouth, with your gloves on, let the baby suck your finger. Train. 1, 2, 3, suck. Pull it out. 1, 2, 3, suck. Pull it out. Para matrain yung tongue ni baby. Doing like this. Let the baby suck it. Pwede yung dad, the husband mo can do this job so that the baby will be trained to suck from the finger, and then once the baby expert na dito, then you can switch it to the bottle. Yan din ang trick ko na tinuturo ko sa mga moms in our breastfeeding clinic para unti-unting masasanay si baby away from your own nipple at either start from the finger and then do the bottle or the nipple. Now, make sure you buy the right nipple. Huwag kayong bumili ng mamahaling mga nipple kung ano-anong shape ng nipple, okay? Watch my previous video again so on how to choose the right nipple. Again, these are the things that you need to know about nipple confusion. It's now nipple preference, okay? There is no such thing as nipple confusion now in the new research. Years ago, yun ang sinasabi ng mga ibang mga healthcare provider. But those who are not updated with the research, hindi nila alam. So it's the nipple preference, not confusion. Thank you for watching and I hope you learned something. Please don't forget to subscribe and I'll see you again for more videos about moms, babies, your health, and the family's health. Bye for now and please subscribe. Thank you.